Alright, next up we're going to cover bacterial endocarditis. Now, endocarditis is inflammation of the endocardium, which is the inner layer of the heart. This can be due to multiple causes, but we're going to discuss bacterial endocarditis here. Now, bacterial endocarditis is exactly what you might think it would be. It's a bacterial infection of the endocardium, most commonly involving the heart valves. So how do you think it would present? You've got it, fever and a new murmur. And if you see these two things in a question stem or on the wards, you need to be thinking endocarditis. To me, this presentation is fairly similar to that of meningitis, which is fever plus a headache. And if you see this presentation, you need to be thinking meningitis. So just to cover that again, fever plus a new murmur, be thinking endocarditis, and fever and a headache, be thinking meningitis. Now there are several other findings that are associated with bacterial endocarditis, and this can be remembered with the mnemonic bacteria from Jane, as you can see here. Now here, the F will stand for fever, and the R stands for, there you go, you got it, Roth spots. And you can see an example of these here. Now Roth spots are white spots that you can see on the retina surrounded by hemorrhage. Now this image could actually show up on your test, or it may just be described in words, which would show up as something like, on retinal exam, white spots are seen with surrounding hemorrhage. Now you are not likely to see the actual words Roth spots on your exam, because this is considered a buzzword, and buzzwords are fairly uncommon for exams. Now next up we have the O, which stands for Osler nodes, and you can see an example of these here. Now these are painful raised lesions that are commonly seen on the hands and feet. And now next, this leads us to our M, which stands for murmur, and this is something that we mentioned earlier, new murmur and fever, be thinking endocarditis. And then we have J, which stands for Janeway lesions, and you can see an example of this here. Now Janeway lesions are small, painless, erythematous spots on the hands and feet. Remembering the difference between Janeway lesions and Osler nodes is usually not too difficult. Osler nodes hurt, which leads us to the saying, ouch, ouch, Osler, and Janeway lesions do not. And if that doesn't help it stick, you can also just look at the name. You have Osler nodes, and nodes are raised. So just remember it however it works for you. And next up we have A, which stands for anemia. And do you remember what type of anemia this would be? There you go. It's usually anemia of chronic disease for endocarditis. Now can you remember the mechanism? There you go. Our bodies have an adaptive response to try to hide iron anytime our immune system is activated. So even if there are no bugs present, hepcidin is produced in response to the inflammation. And now remember, hepcidin binds the iron, and this leads to the development of anemia of chronic disease. Now next up, we have the N, which stands for nail bed hemorrhages, and you can see an example of these here. And these are also commonly called splinter hemorrhages. And last but not least, we have the E, which stands for emboli, and you can see an example of these here. Now these emboli can be potentially devastating, and they can lead to septic arterial emboli or pulmonary emboli, and this is what our image is depicting. You can also see these emboli within the brain, the kidneys, or even the extremities. Alright, now that we've covered the associated findings, let's talk about the individual bugs. Now Staph aureus is able to damage previously healthy valves and form vegetations. And through this process, it helps us understand how Staph aureus actually affects the body, as well as how bacterial endocarditis causes some of its classic findings. So let's start off with a normal healthy valve, as you can see here. So first off, hyaluronic acid is highly expressed on heart valves. And Staph aureus possesses an enzyme that breaks down hyaluronic acid, called hyaluronidase. The expression of hyaluronidase breaks down the hyaluronic acid itself and leads to valve damage. Also, valves are covered with a layer of endothelial cells, and Staph aureus has a toxin called leukocidin, which directly causes endothelial cell necrosis by inserting pores into the cell membrane. So as you might can see, that through this entire process, we first had our normal healthy valves, and after they were acted on by hyaluronidase, as well as leukocidin, we have damaged valves. And with all that, you can see a better image of that right here. So here you go, damaged heart valves with vegetation formation. So I know we talked about how the valves were damaged, but how do you actually form this vegetation? So after leukocidin acts on our endothelial cells and causes damage, they actually liberate von Willebrand factor as well as factor VIII. Now von Willebrand factor is going to initiate platelet plug formation, and factor VIII is going to set off clot formation. And the end result is this big chunk of platelets and fibrin which staph gets stuck on. Now these vegetations can easily be dislodged, and when they are liberated, they create septic emboli. Now these emboli can land anywhere, and this gives bacteria a new place to colonize and cause an infection or an abscess. And as we just stated, these emboli are also full of platelets and fibrin, which can cause clots and infarctions wherever they end up. Alright, now that's going to cover how vegetations are formed. Now let's talk about the difference between acute and subacute bacterial endocarditis. So what do you think the difference is between acute and subacute bacterial endocarditis? Well, here the difference is predominantly on the rate of progression. Acute bacterial endocarditis typically develops much quicker and takes place on previously normal valves, as we discussed earlier. This is in contrast to subacute endocarditis, which is usually more of a gradual onset and takes place on diseased or abnormal valves. Now, acute bacterial endocarditis is often due to the highly virulent organism Staph aureus, and subacute bacterial endocarditis is predominantly due to the strep viridans group. So how do you think Staph aureus typically gains access to the heart? There you go, you've got it. It's usually from the skin, and it's typically seen in IV drug users. Here, when you puncture a vein with a non-sterile needle, you're introducing organisms into the bloodstream. Some of these organisms commonly include Staph aureus, but they can also include Candida and Pseudomonas, and IV drug users are susceptible to all of these organisms. Now in this scenario, the tricuspid valve is the one that is most often damaged, as it is first to receive the contaminated blood. So if a question presents an IV drug user, you need to be thinking about tricuspid valve endocarditis. And some of the common organisms here are Staph aureus, Candida, and Pseudomonas. Now an important point to note is that the most common valve affected in endocarditis is actually the mitral valve. But just to reiterate, if you're given an IV drug user, be thinking tricuspid valve endocarditis. Now as we mentioned earlier, subacute endocarditis is more indolent and slower progressing, and this is predominantly due to the fact that it's from lower virulence organisms like viridans streptococcus. Here, your strep viridans group does not possess all the enzymes and toxins that Staph aureus has, and therefore it cannot infect healthy, normal valves. So with that, you need a previously damaged valve. So you'd expect a question to mention something like rheumatic fever, or mitral valve prolapse, or a calcified aortic valve, or a bicuspid aortic valve, or a prosthetic valve in the question stem in someone with subacute bacterial endocarditis. So where exactly does the viridans streptococcus come from? Well, it's actually a commensal organism that is found in the oral cavity. So a common way to obtain this organism is through dental procedures that cause some gingival bleeding, and this is enough for the bacteria to gain access to the bloodstream. This is why some patients get antibiotic prophylaxis prior to dental procedures. And while you'll need to know the exacts of who's supposed to and not supposed to get antibiotics for step 2 and step 3, it's not quite as high yield for step 1, so just be on the lookout for that moving forward. Alright, now to cover a few other causes of bacterial endocarditis. Now, strep bovis and Clostridium species are causes of bacterial endocarditis that are associated with colon cancer. And why do you think this is? Well, both of these organisms are found within our large colon, and if someone has a malignant tumor within the colon, it's going to cause ulcerations and bleeding within the colonic mucosa. This then gives the organism perfect access to the bloodstream, and that's exactly how it makes it to the heart. And I'll go ahead and tell you that it doesn't have to just be colon cancer. It can actually be any colonic pathology that leads to bleeding and ulceration. Now this could be anything from ulcerative colitis to diverticulitis. Now what you need to remember here is what's going to show up on test day. And that's going to be that strep bovis caused bacterial endocarditis in the patient with colon cancer. And to get even more specific, the question you'll get is that someone has bacterial endocarditis. So they have a new murmur and a fever. And you get blood cultures that show strep bovis. And then they'll ask you, what do you want to do next? And the answer is going to be a colonoscopy, because you want to go find that colon cancer. And now next up, we have Staph epidermidis. And this is found everywhere on the skin, hence its name, epidermidis. Now what you need to remember for Staph epi is that it infects foreign bodies within patients. These can be anything from pacemakers to prosthetic joints and even prosthetic heart valves. And if it infects a prosthetic heart valve, you have bacterial endocarditis, which is what our lecture is about. So what about culture-negative endocarditis? There are actually several organisms that can cause culture-negative endocarditis, as they are just extremely difficult to grow in culture. Some of these commonly include Coxiella brunetti and Bartonella species. And can you think why this might be? There you go. These are intracellular organisms, and they essentially won't grow on our standard culture mediums. So what will the question ask if it's trying to get you to pick one of these two? Well, for Coxiella, the vignette will say something about a farm animal giving birth, as it's commonly found in amniotic fluid. And if the vignette mentions something about getting scratched by a cat, be on the lookout for Bartonella. Now, other potential causes of culture-negative endocarditis include the Hayseck organisms, and these include Haemophilus, Agrobacter, Cardiobacter, Eikenella, and Kingella. These guys all have very strict growth requirements and don't really grow on our routine cultures. So after all that, what do you think is the most common cause of culture-negative bacterial endocarditis in the hospital setting? Well, this one's being a little tricky, and it's just that the patient has received antibiotics prior to obtaining cultures. Now, this is unlikely to ever show up on your test, but it's just good real-life knowledge that you need to know of when you start taking care of patients with bacterial endocarditis. Alright, now let's cover some of the complications of endocarditis. So bacteria can damage the chordae tendineae and cause chordae rupture, leading to complete valve failure. Now, if this happens, it often presents with a rapid onset of heart failure symptoms, and these include shortness of breath and even frothy sputum production. Bacteria can also extend from the myocardium into the pericardium, where they infect the pericardial sac and cause a suppurative pericarditis. And you can also get a glomerulonephritis, and this is because your immune system has ramped up producing antibodies to these bacteria. These antibodies then bind the bacteria and form an immune complex, and it's this immune complex that then deposits within the glomerular basement membrane. Now, once this immune complex gets stuck here, it's going to activate complement, creating inflammation within the glomerulus, leading to glomerulonephritis. And just a little side fact, glomerulonephritis was actually the most common cause of death in patients with endocarditis prior to the development of antibiotics. Now, what about non-bacterial endocarditis? There are several different causes of this, and we'll discuss a few here. Now, non-bacterial endocarditis often carries several names. One common name is merantic endocarditis, and another is thrombotic vegetations. Now, these are commonly seen in malignancy, hypercoagulable states, as well as in lupus. A particularly high yield association here is mucinous cystadenocarcinoma, which is a cancer that produces tons of mucus. Fibrinogen and platelets easily get stuck to this viscous mucus secreted by the tumor, and this initiates clot formation. This clot can then attach itself to a heart valve and cause non-bacterial endocarditis. Now, a pretty high yield point here is that sterile vegetations commonly get stuck on the inferior side of the heart valve, as opposed to bacterial vegetations, which are commonly found on the superior side of heart valves. Now, what would you be thinking if you had vegetations on both sides of the heart valve? There you go. It'd be lupus. Remember that lupus is an autoimmune disease in which the body forms autoantibodies to many different types of cells and cellular products. Some of these antibodies include anti-cardiolipin antibody, which is an autoantibody against cardiolipin found in animal hearts. Now, these antibodies can stick to both sides of the heart valve, leading to vegetation formation on both sides of the valve. And now, do you remember what these vegetations are called when they're seen in lupus and on both sides of the heart valve? There you go, Liebman-Sachs endocarditis. Now, once again, don't expect the classic buzzword Liebman-Sachs endocarditis on your test. Just be expected for them to describe vegetations on both sides of the heart valve. Alright, well, that's going to wrap up bacterial endocarditis. See you in the next video.